Sit down, relax, and gently move your feet like this in just a moment. I'll show you exactly how to do this simple ankle movement safely, how often you might practice it, and why you shouldn't think of it as a magic solution for bloating. Point 1. You can think of each repetition as one gentle cycle, toes towards you, then toes away. Keep repeating at a comfortable pace without rushing or straining. Start by sitting in a sturdy chair with your back supported, and both feet resting comfortably on the floor. Slowly bring your toes toward your body, then gently point them away again. The movement should come from your ankles, while the rest of your body stays relaxed. You don't need to make the movement large if your ankles are stiff. Simply use the range of motion that feels comfortable. The goal isn't to stretch as far as possible or make your muscles tired. Keep breathing normally throughout the movement if you notice pain, dizziness, unusual discomfort, or anything that doesn't feel right. Stop and give yourself a break. Point 2. So keep the movement gentle, keep your expectations realistic, and pay attention to the bigger picture. Your post-meal habits are about more than just one exercise. Ankle pumps can be a convenient way to add some gentle movement while you're seated, especially if walking after a meal isn't comfortable or practical for you, but it's important not to think of this exercise as a treatment that directly removes gas or prevents bloating. Gas and bloating can happen for many different reasons. Eating quickly, swallowing air, eating large meals, certain foods, constipation, and some digestive conditions can all play a role. That's why this simple movement should be considered one small part of a healthy routine, rather than a guaranteed solution. Point 3. One of the biggest advantages of ankle pumps is that you can perform them while sitting. You don't need special equipment, a gym membership, or a large amount of space. A stable chair is usually enough. This can be especially practical for older adults who may not feel comfortable walking immediately after eating. If you're able to walk safely, gentle walking can also be part of an active lifestyle. But if walking isn't an option, seated ankle movements give you another simple way to keep your lower legs moving. Point 4. Now pay attention to how much force you're using. There should be no need to push your toes aggressively towards you or point them as far away as possible. Your movement should remain smooth and controlled. Imagine you're simply waking up your ankles. Rather than exercising as hard as you can, a smaller movement is completely fine if you have limited flexibility. What matters most is that the movement feels comfortable and controlled. Point 5. Your breathing is another small detail that's easy to overlook. While doing ankle pumps, breathe normally. There's no reason to hold your breath or tighten your entire body. Relax your shoulders, keep your face relaxed, and allow your legs to stay comfortable. This isn't supposed to feel like an intense workout. If you find yourself straining or becoming short of breath, slow down and take a break. Point 6. Now let's talk about timing. You don't have to perform ankle pumps immediately after taking your last bite. Simply finish your meal. Get into a comfortable seated position and allow yourself to relax. You can then perform a few gentle repetitions as part of your normal post-meal routine. The exact number isn't the most important part. What matters is choosing an amount that feels appropriate for your body and your current level of mobility. If you've been given specific exercise instructions by your doctor or physiotherapist, those instructions should take priority over a general routine. From a video. Point 7. Another important point is that you don't have to make this exercise complicated. You can move both feet at the same time, slowly bringing the toes towards you and then away. If one ankle is stiffer than the other, don't force it to match the other side. Your flexibility and mobility may naturally be different from someone else's, especially if you've had previous injuries, joint problems, or surgery. Work within your own comfortable range, and remember the goal is gentle movement, not perfect technique or a large number of repetitions. Point 8. If you're specifically watching this because you experience gas or bloating after meals, it's important to look beyond the exercise. Pay attention to what you're eating and how you're eating. Eating too quickly can cause you to swallow more air. Large meals may make some people feel excessively full. Carbonated drinks can also contribute to gas for some individuals. Certain foods may trigger bloating in some people, but cause no problem for others. So instead of assuming that one exercise will solve everything, start looking for patterns. You might notice that your symptoms happen after particular foods, after large meals, or when you eat very quickly. Keeping a simple food and symptom diary can sometimes help you identify those patterns. Point 9. You should also avoid turning this into a competition. You don't need hundreds of repetitions, and you don't need to move as quickly as possible. Start with a comfortable number of repetitions and see how your ankles respond. If the movement feels easy and comfortable, that's perfectly fine. Point 10. If you can walk safely after meals, ankle pumps don't necessarily need to replace walking. They are simply another option for gentle movement, especially when you prefer to remain seated or have difficulty walking. Choose the option that fits your mobility and daily routine. Point 11. And remember that your individual health matters. If you have a recent injury, surgery, significant swelling, balance problems, or another condition affecting your legs or feet, ask a healthcare professional whether this movement is appropriate for you. Don't force an exercise simply because it's described as gentle. Point 12. If the movement causes pain, stop. A gentle exercise should not require you to push through significant discomfort. Point 13. If bloating happens frequently or keeps getting worse, don't simply assume it's part of getting older. Persistent digestive symptoms deserve proper attention. Point 14. And if bloating occurs with severe abdominal pain, repeated vomiting, blood in the stool, unexplained weight loss, or other concerning symptoms, seek medical advice rather than relying on home exercises. Point 15. So let's put everything together. After finishing a meal, sit comfortably in a stable chair. Keep both feet supported and allow your body to relax. Then begin the ankle pumps. Bring your toes gently towards you, then slowly point them away. Repeat the movement at a comfortable pace. Keep your breathing natural, avoid rushing, and don't force your ankles beyond their comfortable range of motion. You can think of this as a small movement break after eating, rather than a workout. And most importantly, keep your expectations realistic. Ankle pumps are not a proven way to prevent gas or bloating, and they cannot treat the underlying causes of persistent digestive symptoms. What they can do is provide a simple form of seated ankle movement that may fit conveniently into your daily routine, particularly if walking isn't practical for you. For better digestive comfort, look at the bigger picture. Eat slowly, pay attention to portion sizes. Notice which foods or drinks seem to trigger your symptoms. Stay appropriately hydrated. Keep physically active according to your abilities. And if your bloating is persistent, severe, or accompanied by concerning symptoms, talk with a healthcare professional. You don't need a complicated routine to start taking better care of your body. Sometimes a small and realistic habit is a good place to begin.